Hello everybody, hi, I'm Jewel and welcome to my channel. Today's topic is study finds exercises improve overall fitness of older kidney patients. Exercises for older patients with chronic kidney disease, CKD, is not only safe but can improve their overall physical fitness, investigators found and presented at the National Kidney Foundation's 2019 Spring Clinical Meeting in Boston this week. The investigators evaluated the impact of an exercise intervention in community-dwelling adults with later stages of CKD. Older adults with advanced chronic kidney disease have significantly impaired physical functions, but with a structured exercise program, they can achieve real improvements in physical performance, said Dr. Steven Segler of the University of Maryland School of Medicine in Baltimore and the Baltimore, Virginia Generic Research, Education and Clinical Center, and one of the authors of this report. The team of researchers randomized CKD patients into two groups. One participating in a supervised exercise program 3 times per week, and a control group provided health education classes. Measures of physical function were evaluated over a 12-month period. We designed this research to look at the effects of both exercise on the physical fitness and mental fitness, says Dr. Daniel Werner, a nephrologist at Tufts Medical Center and Tufts University in Boston. The research is most meaningful if we can get medical professionals to promote exercise in people with advanced CKD in a way that is scalable and widely adaptable to community settings. The investigators presented their findings during a session at the National Kidney Foundation event. Thousands of nephrologists and kidney care professionals gather once a year to learn about the latest research and practices in kidney health. When people living with advanced CKD or nephrologists think about lifestyle modification, medical nutrition therapy is probably the top consideration, added Joseph Facchetti, MD and KF Medical Chief Medical Officer, who was not involved in this study. This hypothesis generating study suggests supervised increase in physical activity is an additional important, potentially impactful therapy. The National Spring Clinical Meeting, for the past 27 years, nephrologists, healthcare professionals from across the country have come to the National Kidney Foundation Spring Clinical Meeting to learn about the newest developments related to all aspects of nephrology practice, network and with colleagues, and present their research findings. The National Spring Cleaning Meetings are designed for meaningful change in the multidisciplinary healthcare team skills, performance, and patient overall health outcomes. It is the only conference of its kind that focuses on translating science into practice for the entire healthcare team. This year's spring clinical meetings will be held between May 8th and 12th in Boston, Massachusetts. Okay, guys, this is Study Finds Exercise Improves Overall Fitness for Older Kidney Patients. This study was presented, as it says, in the National Kidney Foundation Spring Clinical Meeting in Boston this week. And there were a lot of interesting things that came out of this meeting, guys, that I will talk about on later videos. But I think this video basically speaks for itself, that as we get older, we have to keep moving. And we have to keep moving for our own physical health, to stay flexible, and of course for our own mental health, to think clearly and to just have an overall general good health. So guys, if you like this video and found it useful in any way, please like, share, and subscribe. And as always, we're sending you lots of love and affection. And as you see, with this meeting that happened in Boston, this week, there's so many people that are in the background working towards our better health. trying, new solutions, trying to come up with innovations to make us the healthiest that we could be. So guys, the only thing that we have to do as patients, as kidney patients, is be compliant with our doctors, follow the directions that, what they put out that are good and good for us, for our overall health. And of course, to stay positive, and of course, to stay hopeful, and everything will be, the way it should be, I guess, for all of us. So, guys, take care of yourselves. And until the next video, take care. Bye.